Hi, my name is Alex Holbrook. I am a nursing student in the LPN to BSN program at Indiana State University. Sexually transmitted infections, education, screening, and prevention for teens. Throughout the course of this presentation, these are the following learning objectives. Number 1, define sexually transmitted disease, or STI. 2, identify risk factors for STIs among teens. 3, describe signs and symptoms of common STIs. 4, identify screening methods and locations. 5, identify common treatments for STIs. 6, describe strategies used to prevent STIs. Before we begin, please click the link below and complete the pre-test. After you have completed the test, please resume the presentation. There will be another test following the presentation. While you are down there, please click and download the handout for additional information related to this presentation. Sexually transmitted infection, also known as an STI, is an infection or disease process that is transmitted from one person to another through sexual contact. The following are some common STIs. Chlamydia is a bacterial infection that can affect either sex, can be present with burning urination or no symptoms at all. Chlamydia can be diagnosed with a urine test. Unlike other STIs, chlamydia can be treated with antibiotics and cured. However, if chlamydia goes untreated, it can lead to some serious complications, such as scarring, infertility, and urinary problems. Gonorrhea. Like chlamydia, it is also a bacterial infection that can affect either sex. Gonorrhea can present with burning urination, urinary frequency, yellow-green discharge, or abdominal pain. Like chlamydia, gonorrhea can be diagnosed with a urine test and also treated with antibiotics. However, gonorrhea usually takes oral azithromycin and ceftriaxone injections, as opposed to chlamydia with an oral antibiotic. Another common STI is genital herpes. Genital herpes is characterized by clustered sores on the genitals and/or face or mouth. Genital herpes is caused by transmission of the herpes virus through open sores. It is typically diagnosed by a visual examination of the sores by a physician or healthcare professional. Lack of knowledge can lead to misinformation regarding herpes and transmission. For example, herpes can be passed along through open sores. If the partner does not have any open outbreak, there is a possibility that it may not be transmitted. Although there is no cure for genital herpes, it can be managed with oral antiviral medications. Syphilis is another common STI. Syphilis is a bacterial infection that is transmitted through skin-to-skin contact. The disease progresses over several years. The initial stage consists of a sore that is usually painless, which then, within a certain amount of time, presents as a total body rash. The disease eventually progresses to affect the organ systems. To treat syphilis, it needs to be caught very early and can be treated with antibiotics. If it goes untreated, the effects can be severe or even fatal. A diagnosis of syphilis is verified with a blood test. Human immunodeficiency virus, also known as HIV, is a sexually transmitted virus that attacks the host's immune system. Once the virus has completely destroyed the host's immune system, the disease progresses into AIDS. Almost 1 in 4 of new cases of HIV and AIDS occur in teens and young adults, according to the CDC. Some risk factors that pertain to teens and STIs. First risk factor is risky behavior. This includes having multiple partners, lack of protection such as condoms, and the general attitude of, it won't happen to me. There is also a possibility of a lack of knowledge about STIs. For example, there may be some misconceptions about STIs. Some teens may believe that if they contract an STI, that it may be the end of their life. For example, if someone contracts herpes, they may feel that their sexual life is over and that every partner that they have from here on out will contract the disease. This is false, as genital herpes can be treated with antiviral medications that can reduce the amount of flare-ups, and thus reducing the risk of transmission. Also, teens may be unaware of certain safe sex practices or contraceptions. One of the keys to prevention is advocating for safe sex practices. Abstinence may be 100% effective in preventing STIs, but relying upon abstinence-only education has been shown to be ineffective, as teens will eventually try sex, and if they are not knowledgeable about other ways to prevent STIs or unwanted pregnancies, they will not be prepared in the future. Proper condom use can effectively prevent transmission of most STIs. Also, reducing the risky behavior by eliminating multiple partners without protection can lower risk of STI transmission and infection. As for education, teens should be educated about safe sex practices. They should also be educated on signs and symptoms of certain STIs that may prompt them to go and get testing and possibly treatment. The teens should also be educated on the available resources for testing. One such place that they can receive testing would be a community health clinic or a clinic similar to Planned Parenthood. These clinics usually offer discreet, no-cost testing and treatment for STIs. They also offer different forms of birth control options, and sometimes they can also offer safe sex implements like condoms. These health clinics also are a wealth of information and educational resources. It can allow teens to go and speak with a health professional about STIs and answer any questions that they may have. This concludes the presentation. Thank you for listening. Please click the link below to take the post-test.